Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, my friends, we are back, and you're watching Healthy Living Tuesday right here on KOM News Extra. Could not wait to bring this segment to you because Dr. Jitka Lom, the principal physician from Express Care, is here, as she is dutifully every Tuesday. Now, Dr. Lom, we are going to debunk some health myths.
Okay.
You know, these are either old wives' tales, for lack of a more politically correct term, or they're just stuff that people made up or, you know, passed from generation to generation. So we have a bunch of these so-called health myths. Are you ready?
I'm ready.
Some of these are really, really wacky. Okay. First of all, this is maybe a softball question for someone in your profession. Is hydrogen peroxide really good for cuts?
It's actually really not good for cuts. Please stop using it. You know, after you've already had the insult of a cut, you don't need the injury of hydrogen peroxide. And hydrogen peroxide is actually, it's toxic to tissue. It's a very strong acid, and it will burn your skin. Yes, it will kill all the bacteria, but also kills healing tissue. So if you have to use it, please use it only once. Please use it in a dilute form, and please don't keep using it to try to clean your wounds over days and days and days, because I see this all the time. Somebody will cut in and say, see, my wound is not healing, because they keep pouring peroxide on it. Basically, they will not allow it to heal because the tissue keeps getting destroyed by the peroxide. So best way to take care of a cut is just use warm water and soap, wash it with warm water and soap, and rinse it and rinse it and rinse it until it's clean, and that's it.
Okay, well, health myth number 2 comes from my good friend Carlito here. He's one of our photographers now. Is it pronounced Salampes or Salonpas, that product? Everybody gets this one wrong.
I don't know. I hear Salonpas.
Yeah, people here say Salonpas, but you see the stateside commercial, and there's use Salonpas. But I have no idea.
I don't know.
Okay. To a more serious subject, will eating red meat really cause a heart attack?
No, it really won't. You know, the red meat by itself, depending on if it's a lean red meat or if it's, you know, organic, or if it's a very fried red meat or whatever it is, the red meat by itself is not toxic to you. It's healthy. It can be cooked in a very healthful way. What's harmful to you is if you keep eating tons of meat that's not prepared properly, and your cholesterol is very high, because that way you're ingesting more and more and more fat. And first of all, you'll get fatter, more obese, and your cholesterol will go up, and in that way you may increase your risk factors for heart disease. But red meat by itself is not a risk factor for heart disease.
Okay, and we'll dovetail off that. Can drinking red wine actually reduce the chance of a heart attack?
It can, and that's because of the,
Ding!
yeah, that's good. That's the antioxidants in the red wine. You can have one or two glasses a day, and that's healthy.
Okay, so far 2 thumbs down and 1 thumb up, and Salumpas, Salonpas, we have no idea.
Sure.
Okay, okay. Are ulcers truly caused by stress?
There is something called a stress ulcer. This is caused when you're extremely ill in the hospital. Like, for example, an ICU patient will develop a stress ulcer from their severe illness. Not the kind of stress that we would talk about, like I'm upset over certain things in my life, that kind of stress. So most ulcers are not caused by stress. They're caused by a bacteria called H. pylori that makes a home in your stomach. And this is very common. Many people have the H. pylori bacteria. But sometimes it will overgrow, especially if it has a good environment with not a lot of acid. And it will basically burrow into the stomach lining and create a wound and a sore. And that's called an ulcer. So most ulcers are not caused by stress. They're caused by the bacteria.
Okay, so that's another thumbs down.
Down.
Okay, so we put that one to shame. Okay, something else involving the stomach. I went to public school and I grew up in the 80s, so we constantly lived in fear of, if you eat Pop Rocks, the famous candy, and you drink cola, will it cause your stomach to explode?
Well, you're still here to tell the tale.
I've never tried it. I'm terrified of that. But have you ever heard about that?
No. I think if you eat any food and you create a lot of gas in your stomach for whatever reason, like the volcano, you know, from science projects or whatever, if you create that in your stomach, there's a way for it to go both up and out the other way, and you'll be fine.
And the acid, like the stomach lining,
you'll burp or you'll pass wind, and you'll be just fine.
Okay, and the stomach lining, that's some pretty serious acid itself, and I mean, considering what it breaks down, I mean, that's really strong.
But actually, our stomach acid is an incredibly strong acid. It's pH of 1, and our stomach is built to have a strong acid in it. So that's fine. The reason we get heartburn and pain is not because there's acid in our stomach, it's because the acid is actually moving in the wrong direction into our esophagus,
Right.
and it burns our esophagus, and then that hurts.
Okay, so thumbs down. After 25 years, we now definitively know. All right, here's something interesting, and I believe this is something unique to Guam. Dr. Lom, does putting Vicks Vapor Rub on your feet at night really stop fevers and coughing?
I don't think so. The Vicks Vapor Rub has menthol in it. Menthol is a mild analgesic, meaning it will reduce some pain. So it's used in Tiger Balm and so on to put on your sore muscles. It's also used as a cough suppressant, put it on your chest and so on, and that does work. As far as fever, I don't believe that it's an effective fever reducer, maybe for very minor fevers, but not for anything over, let's say, 100.
Will the menthol effects of it maybe cause to lower, or maybe just like help you mentally feel better?
Yeah, because menthol actually creates a cooling effect.
Right.
When you put it on, it feels like your skin is colder, even though actually the temperature is pretty much the same. But the receptors on your skin that respond to hot and cold, the hot ones get wiped out, so it feels like everything's cold on your skin. That's how that works. And so you can feel cooler, but your temperature internally is about the same. Okay,
last one for those of us who frequent public restrooms. Are jet hand dryers really more sanitary than paper towels?
No, they're actually not. This is one of those unintended consequences. So yeah, in the it was a great idea. Save the trees. It's more environmental. You don't have a lot of trash and all of that with jet dryers, except that you actually increase the amount of bacteria on people's hands by about 100%. So it's actually probably better for you not to wash your hands at all if you're gonna do that. But the reason is because jet dryers blow a lot of bacteria around, and there's a lot more airborne bacteria in the bathroom there. And another thing is that people are impatient and they don't actually finish drying their hands. So as they're rubbing their hands and so on, they're just basically rubbing more bacteria into their hands. Whereas if they just take a paper towel, wipe their hands, and remove the bacteria, throw it in the trash, their bacteria count goes lower.
See, and that is why you went to med school, so that you can sit here with a dork like me and answer medical questions. So thanks so much.
Thank you.
Fun segment. All right, stay tuned. We're back after this.